This year, 22 states across the country are changing what people on food assistance can buy with their benefits. The new rules are meant to cut out sugary foods and drinks, a central focus of the Make America Healthy Again movement.
But advocates fear they could cut down on what food is available for those in need. Stephanie Sy traveled to Texas, which just introduced its ban, to learn how these new cuts will affect businesses and families.
At this modest house in Garland, Texas, a line stretches out the door and down the sidewalk.
Hi, how are you?
Every weekday, Good Samaritans of Garland welcomes around 300 families to its food pantry.
Food is what brings them in, because that's the first thing you think of. Hunger is what takes over your mind and your body.
Sarah Kennefick is the pantry's executive director. She says many here depend on the federal government's Supplemental Nutrition Assistance Program, or SNAP, to buy groceries. But it's not enough, so they come here. In Texas, the average SNAP recipient receives $6 per day.
I mean, you just look at our economy. Things are costing more money, but the other things are not changing. The amount of money we make, our minimum wage, our SNAP benefits, all of those things are not changing.
And as of this month, SNAP benefits in the Lone Star State can no longer be used for sweetened drinks like soda or items defined as candy. Allowing states to introduce these types of bans is a pillar of Health Secretary Robert F. Kennedy Jr.'s Make America Healthy Again agenda.
We're not giving our children good food. Taxpayer dollars should not be funding these injuries to our children. And we pay for it twice. We pay for it through the SNAP program, and we pay for it later on with diabetes and obesity.
21 other states are rolling out similar restrictions, but in some places implementation has been rocky. In Texas, some of those who receive SNAP say the guidelines are confusing.
For example, one SNAP benefit recipient we spoke to likes to buy energy drinks for her kids when they play sports. But with 17 added grams of sugar, that mom can no longer buy this with her SNAP benefits.
The state's definition of candy has also raised some eyebrows. It includes chocolate, but also gum and yogurt-covered nuts and raisins.
I've seen reports from acquaintances that I tried to check out, my entire transaction was declined, and I had to figure out what was not covered.
So what does that mean for somebody at the checkout counter?
It is downright embarrassing. If they don't have the cash to cover, because I've been that person, what do you put back? How do you know what to put back?
Garland mom Brittany Quick visits Good Samaritans every other week. She used SNAP for years to help feed her family of 4. She says the changes might restrict a family's options for things like special occasions.
I reminded people like, hey, this ban's going into effect. If you're using your SNAP benefits to help pay for your kid's Easter basket, make sure you go ahead and purchase it before the 30th. So I know a lot of friends were like, oh, I didn't even think of that.
There are other things she says regulators may not have thought about.
My kid says he has an upset stomach. I go buy Sprite or ginger ale, whatever it is that gets fluids in him to stay in him.
I feel that they are so detrimental to your health.
Stacey Ellis, a registered dietitian and nutritionist, agrees with the ban, especially on soda.
When you're consuming it, it's going straight into your bloodstream. It's causing your blood sugar to spike. Your body doesn't like your blood sugar spiking, and so it's going to take it and turn it into triglycerides. And so if you do that day after day, that's going to further increase your risk of heart disease. And then you'll have what we call prediabetes and eventually diabetes. It's a chronic condition, so it slowly starts to deteriorate your body.
Diet-related chronic diseases are the leading cause of death in the U.S. Obesity and diabetes alone cost the healthcare system an estimated $586 billion a year.
When it comes to the government's role in what we eat, what do you think that should be?
I understand people's concern with not allowing people access to certain foods. We do have the freedom to consume whatever we like, but I do think the government has a role in educating the population of what we should and should not eat.
So the patient in room 102.
Leslie Redden is a family nurse practitioner in South Dallas, a predominantly black neighborhood where at 68 years, life expectancy is more than 10 years less than the national average.
We're seeing a significant amount of prediabetes actually in our younger population these days.
How young?
I would say my youngest is probably 9 right now, that is in the pre-diabetic range that I'm personally caring for. And then we see a significant increase in cholesterol levels as well.
But she says for many of her patients, sugary snacks and drinks aren't a preference. Instead, they may be one of the few ways to get calories for the day.
I don't believe we actually even have a commercial grocery store in this zip code, so like a chain grocery store.
Reducing sugary drinks, reducing candy, from an outsider's perspective, seems like a good idea.
I mean, it's actually the ideal. You know, I would love for all of my patients to be walking into the store that's across the street that's available to them with their parents and saying, hey, you know, like, what can I buy with my benefits today? And that's going to be, you know, fresh fruits and fresh vegetables, but that's not what we have. That's not what they have access to by reducing the unhealthy foods. It just reduces the amount of food that they can purchase.
What they do have access to, convenience stores.
A lot of small businesses like ours aren't going to have like grocery aisles like lettuce and produce and all of that stuff.
Andy Torres says the restrictions have hit his customers and are unclear.
I think it'd be better if they had like an exact list, because there's kind of like a gray area of what you can and can't sell that's not really specified.
It will also affect his bottom line. An analysis by the National Grocers Association shows the cost to convenience stores to cover changes and ensure compliance with the new restrictions could total $1 billion.
And I get to see the progress.
Nutritionist Stacey Ellis is optimistic about the health outcomes that may result.
I do feel that the message that the government gives plays a huge role in what its citizens will consume. I really think that we will see some improvements.
But Brittany Quick says the new restrictions won't make her drink less soda. And for many busy working parents, convenience is driving their choices.
The ability to walk by the freezer, grab something, and go out and hand it to my child in the car, say, eat this on the way, because I was so busy I forgot to make time to make a meal. That's the war that goes on in any parent's head.
For parents with few options to put food on the table, Quick says the SNAP restrictions are just one extra burden to carry. For the PBS News Hour, I'm Stephanie Sy in Garland, Texas.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.